Hello all, today we are discussing about pleural effusion. The term pleural means space between chest cavity and lungs. Effusion means collection of fluid. So we will call pleural effusion as a collection of fluid in the pleural space. Normally the pleural fluid must be present within 10 to 20 ml. If it is more than the normal amount, we will call this condition as pleural effusion. So there is always a tiny bit of plasma that leaks out of capillaries and get into the space. Since the capillaries are so close to the edge of the pleural space, and then fluid collects in the pleural space. The excess fluid can drain by lymphatic vessels in the pleural, then drain the fluid away and deliver it back into the circulatory system. So when we see the definition, pleural effusion is sometimes referred to as water on the lungs. Is a medical condition characterized by the abnormal accumulation of fluid in the pleural space. Normally, this space contains a very small amount of fluid that acts as a lubricant to help the lungs move smoothly during breathing. When too much fluid builds up, it can put pressure on the lungs, making it difficult to expand fully and causing breathing problem. Then it is classified into two types, transductive pleural effusion and exudative pleural effusion. This classification is based on the characteristics of the fluid and underlying cause. First of all, we can see transuddative pleural effusion. So the fluid, when we see the fluid, usually clear watery fluid with low protein content. Then causes pathina, this type is caused by fluid leaking into the pleural space as a result of their low blood protein count or increased pressure in the blood pressure. So it is always a systemic problem. So it's one of the most common causes: congestive heart failure, then liver cirrhosis, kidney disease. In kidney disease, we will call the condition nephrotic syndrome. Nephrotic syndrome means protein is lost in urine. Then next one is exudative pleural effusion. So here fluid is often cloudy or bloody with high protein content. So this type is caused by whether the blocked limb or blood vessels are there, or any local inflammation or tumors or any lung injuries. So then common conditions that could result in this type of pleural effusion include pulmonary embolism, pneumonia and fungal infection. Then we can see the symptoms. So the severity of the symptoms often depends on the amount of fluid accumulated. First of all, we can see the shortness of breath. So most common symptoms caused by fluid preventing the lungs from the fully expanding. Then dry unproductive cough, difficulty breathing especially when lying down, fever and chills in case of infection like pneumonia, then inability to take deep breath. So here some people do not experience symptoms of pleural effusion at all. They usually find out about the liquid in their lungs after a physical exam for an unrelated condition. Then we can see about diagnosis of pleural effusion. First of all, we will go to physical examination. So here we will listen the lungs by stethoscope, then CT scan. So CT scan will provide more detailed image of lungs and pleural space. Then chest X-ray. So chest X-ray is often the first test to visualize the fluid. Then chest ultrasound. It helps to locate the fluid and guide procedure. Then pleural fluid analysis, that is thoracentesis. Then bronchoscopy, pleural biopsy. Then we can see about treatment. So in treatment, first of all, for pneumonia we will give antibiotics. Then for congestive cardiac failure, diuretics are given. Then procedures can be, some of the procedures can be performed like thoracentesis. Thoracentesis, if effusion is large, more fluid is taken just to ease the symptoms. Then tube thoracostomy or chest tube insertion. So here the doctor makes a small cut in the chest wall and puts a plastic tube into the pleural space for several days. Then pleural drain. Pleural effusion keeps coming back. A long time catheter is put through the skin into the pleural space to drain the effusion. Then pleurodesis. The physician injects a irritating substance through a chest tube into the pleural space. The substance such as tail or